I was sorting laundry when a white cotton sock stopped me cold. A translucent half-moon at the heel carried the whole memory of my nightly experiment. Warm hands, slow rubbing, a thin layer of castor oil, and a sock pulled over it before bed. My feet had felt warmer afterward. When I pressed a toe with my thumb, color returned to the skin, and I had treated that little change as proof that the oil had opened deeper vessels. That certainty felt comforting precisely because it seemed so visible. The stain made me realize how many things had arrived together: touch, friction, warmth, fabric, rest, and oil. At 83, I still walk to the corner shop, inspect my own heels, and notice when one shoe begins wearing differently from the other. Living in an old body teaches observation. It does not let me diagnose an artery by pressing a toe or turn a pleasant sensation into a clinical measurement. Warmth, rubbing, fabric, and oil had arrived together, so the stain could not tell me which one changed what I felt. It also could not tell me whether the change stayed at the skin or reached muscles, leg arteries, the heart, or erectile tissue. That was the hesitation I needed. I did not have to declare the ritual useless, and I did not have to promote the oil as a nightly vasodilator. To answer what happened to blood flow, I had to separate the massage from the oil and the skin from the arteries beneath it. And because men often hear better circulation as a promise about sexual response, that distinction mattered beyond my feet. For 3 years, I slept 3 feet away from my wife, and it felt like 300 miles. She'd fall asleep first. I'd lie there staring at the ceiling, wide awake, feeling like a roommate in my own marriage. I thought something was wrong with me. It wasn't weakness, and it wasn't just age. Here's what no one ever sits a man down to explain. This isn't about willpower. It's about specific systems in your body quietly losing steam year after year, while nobody tells you it's even happening. The pills my doctor handed me gave me headaches, made my chest feel tight, and honestly, they made me feel like I needed a pill just to feel like a man. I wasn't willing to live like that. There's a gentler way to bring those systems back, without any of that. At 83, my wife and I aren't roommates anymore. I'll show you exactly what changed it in this video, and if you want the simple support I personally use, there's a free presentation linked in the description below. If you rub castor oil on your skin every night, the massage and warmth may make the area feel temporarily warmer, and one small human trial of a specific foot massage technique found an immediate increase in foot skin blood flow. No human trial shows that castor oil itself improves deep, systemic, penile, or leg artery blood flow. In other words, the ritual can create real surface comfort without proving that the oil cleared a vascular problem. That is not an empty result. It is a smaller, safer job than the internet usually gives the container. Castor oil is thick and rich in a fatty acid called ricinoleic acid. On intact skin, an oil can reduce friction during massage and leave an occlusive film that slows water loss. A dry heel may feel softer and less tight. That change can make walking or bedtime more comfortable if the skin is merely dry and unbroken. But softness is not circulation. A shiny surface is not circulation. Warmth is not automatically circulation at the depth people imagine. Skin blood flow can change with temperature, pressure, rubbing, body position, emotion, room conditions, and time of day. If I massage one foot and not the other, the massage itself becomes an intervention. The most directly relevant human study used a randomized crossover design in 25 people with type 2 diabetes and peripheral neuropathy. After one 25-minute session, both self-Thai foot massage and therapist-delivered Thai foot massage increased measured foot skin blood flow immediately. A separate small trial in 26 healthy older adults reported an immediate change in renal blood flow volume and autonomic measures after a specific 15-minute foot massage. Those findings support massage as an active part of the ritual, but their boundaries matter. They tested defined techniques, specific populations, and immediate outcomes, not castor oil, casual nightly rubbing, months of use, narrowed leg arteries, or erections. The lubricant cannot receive credit for what the massage studies observed. The human evidence specifically for topical castor oil is thin. A systematic review of coconut, castor, and argan oils found limited evidence for castor oil mainly around hair luster and no strong evidence for hair growth. That review was about hair and scalp, not blood flow, yet it reveals a larger truth. Even popular topical claims often outrun controlled human studies. Ricinoleic acid does have biological activity in experimental research. An animal study reported analgesic and anti-inflammatory effects in acute and subchronic inflammation models and proposed sensory neuropeptide-related mechanisms. That helps explain scientific interest. It does not establish that household castor oil penetrates human skin in a dose that changes circulation. Inflammation, pain, and blood flow also are not synonyms. A compound can affect one laboratory pathway without becoming a treatment for peripheral artery disease, neuropathy, swelling, varicose veins, or erectile dysfunction. The route, dose, tissue, and outcome must match the claim. I think of polishing the outside of a garden hose. The surface can become smoother and easier to handle, but polish does not clear a narrowing inside the hose. The metaphor has a serious limit. An artery is living tissue, blood flow is regulated throughout the body, and a painful leg is not a home plumbing project. Here is the safe, useful version of the ritual. Start with the skin. Use only a small amount of a plain product on intact skin. Test a small area first and wait for itching, redness, swelling, or a rash. Castor oil-containing products have caused allergic contact dermatitis in case reports, so natural does not mean irritation is impossible. Do not apply it to broken skin, infected areas, unexplained ulcers, or between toes that remain damp. Older adults with diabetes, reduced sensation, poor vision, or known circulation problems may not feel or see injury early. Foot care in those situations deserves individualized guidance. Keep the massage gentle. The purpose is comfort and skin care, not forcing blood through tissue. Avoid deep pressure over a swollen, red, hot, or painful calf. A suspected clot is not something to rub. Sudden one-sided swelling, chest pain, shortness of breath, fainting, or coughing blood needs urgent medical attention. The same principle applies to peripheral artery symptoms. New calf pain that appears with walking and eases with rest, a foot that becomes unusually cold or pale, slow healing sores, color changes, or weak pulses deserve clinical evaluation. Adding more oil can delay the conversation while the underlying problem continues. And do not drink the oil to make the effect work from inside. The U.S. Food and Drug Administration recognizes oral castor oil under laxative labeling, not as a circulation treatment. Oral use can cause cramping, diarrhea, and fluid problems, and has different rules from topical skin use. This video is not a reason to take it internally. My stack for blood flow support begins elsewhere. First is movement suited to my health and balance. Calf muscles help return blood during walking, and regular activity has a far stronger place in cardiovascular care than a skin oil. If walking causes pain or is unsafe, I ask how to adapt it rather than pushing through blindly. Second is risk factor care: blood pressure, glucose, lipids, nicotine exposure, sleep, and prescribed treatment. Those factors can influence vascular health throughout the body. I keep prescribed treatment unchanged because a foot feels warmer after massage. Third is skin protection. Dry, cracked heels can limit comfortable movement, and gentle moisturizing may help keep the surface flexible. Here, castor oil may have an honest supporting role if the skin tolerates it. The benefit is indirect. Comfortable, intact skin can make a walking routine easier to maintain. Fourth is symptom discrimination. I ask whether I am noticing surface dryness, transient warmth, muscle fatigue, nerve sensations, swelling, or exertional pain. I cannot always answer alone, but naming the pattern tells me whether the oil belongs in the solution at all. Fifth is a stop rule. Rash, burning, increased swelling, worsening pain, skin breakdown, or numbness ends the experiment and starts a request for qualified advice. A soothing ritual should never require me to ignore a warning sign. At a community repair table, my friend May can spot a crooked hem from across the room. One afternoon, she watched me favor my right leg and did not ask what oil I used. She asked when the limp began and whether the calf hurt during the walk from the bus. Her question went beneath the stain. Imagine Ray, a fictional composite, age 74. He starts applying castor oil because his heels are dry and his toes feel cold at night. A small patch causes no reaction, and a thin layer makes the skin feel softer. He sleeps in clean cotton socks and enjoys the quiet massage. 2 weeks later, Ray notices calf pain after the same 3 blocks of walking. He first assumes the oil needs more time. Then he remembers that skin comfort and exertional pain are different categories. He does not increase the amount or massage the painful calf aggressively. He schedules an evaluation and brings a clear description of the pattern. Ray keeps using a tolerated moisturizer on intact heel skin if his clinician agrees, but the oil no longer carries responsibility for his arteries. His walking plan and medical care are adjusted to what is actually found. He preserves the ritual without letting the ritual hide the symptom. That is a positive outcome. The oil helped him care for dry skin and made gentle touch easier. The pause at night helped him inspect his feet. The blood flow question led him toward appropriate evaluation rather than false certainty. Each benefit stayed in its proper category. The identity I want is the man who can enjoy surface comfort while remaining alert to vascular function. I do not need to throw away every traditional practice because it lacks a large trial. I do need to stop asking that practice to perform a job it has never demonstrated. So what happens if you use castor oil every night? The covered area may feel warmer, the oil can reduce friction and leave a surface film, and a defined massage technique, not castor oil, has produced an immediate skin flow change in a small human study. You may also develop irritation or an oil-stained sock. What has not been shown is that the oil itself improves deep circulation, treats a blocked artery, or restores penile blood flow. Use the ritual, if you tolerate it, as skincare and a moment of observation. Put movement, risk factor management, and clinical evaluation in charge of the larger circulation story. The container can stay on the shelf without becoming the hero of every vessel in your body. Your erections don't disappear just because you got older. They fade when the systems behind them, blood flow, nitric oxide, hormones, energy, and recovery, slowly stop getting the support they need. Ignore that long enough, and it becomes harder to reverse. That's why I take this concentrated formula every morning. Not one ingredient trying to fix everything, but several working together to support circulation, energy, and drive from the inside out. It's a natural, doctor-backed protocol designed to support pathways your body already knows how to use. No prescription, nothing artificial. Stronger, present, confident again. And unlike the pills I tried, I didn't feel disconnected from my own body. No headaches, just steady, gradual change. My wife noticed before I even said a word. The presentation is linked right below this video. It won't replace your doctor or a healthy lifestyle. It's simply there to support your body. At 83, my wife and I aren't roommates anymore, and it's not too late for you. Tell me in the comments whether you use castor oil for skin comfort, massage, or another reason. Subscribe for more clear, experience-based conversations about men's health after 60.